Let me tell you about some exciting new research by a recent PhD graduate at my department. But first, a bit of background. Tanzania is an East African country of over 50 million population. In the last decades, they've done quite well in terms of health. You see the bubble coming down there, it means child mortality is decreasing. And it's also moving towards the right, which means national income is increasing. Health investments have also improved, but there is one thing. One barrier to improving health further is that the number of medical doctors remains low, even compared to other similar countries in the region around Tanzania. Dr. Nathanael Cirilli has been looking further into this.
We have not attained in any part of the country the minimum threshold of one doctor to 10,000 population recommended by WHO. The picture we had of shortage of doctors in providing services 20 years ago has almost remained the same. At least a better staffed region has around 0.8. So it is close to 1, but it is still below. And you have some regions that has 1 to more than 100,000 doctors.
But why? The problem is not lack of education of medical doctors. Education of new doctors has increased in Tanzania.
There has been a linear increase in the total number. My country has put more resources on the training of doctors, but has not put corresponding resources for employing and retaining them.
Dr. Cirilli found that the newly graduated physicians had difficulty finding their first secure positions. They were often not placed in the geographic area they requested, even when there were vacancies. They were sometimes hesitant about being placed in rural areas, and when they were placed in rural areas, they often did not feel welcome.
We need to balance the efforts between the training and employment. And one of the obvious gaps that we found is that the planners, the trainers, and the employers were not communicating. For now, if I were asked what I should do at this immediate point in time, I think we need to put more resources on employment, at least for the few years.